Let's see.
Hold on. Hi, guys. Welcome back. This is Dr. Samantha, the maternity mentor, and we're here again for our Monday night question and answer session where we go ahead and we take some of the questions that you have asked on the videos and we answer them for you live. Please remember to check out the channel and like and subscribe and hit the notification button as we're trying to put out videos every Tuesday, and we have another video coming out tomorrow for you. And remember, as always, to follow us on Facebook, Instagram, and Twitter for additional content. I also want to let you know that if you have any questions about anything, you should always contact your healthcare provider first because they know you best. All right, so without further ado, we're going to go ahead and start answering some of your questions. Remember, if you have any questions, please feel free to put them into the chat. All right. So our first question is about drinking during pregnancy. It says, is drinking alcohol while pregnant illegal? So this is a very interesting question, and unfortunately, I can't give you a specific answer. It might be illegal to drink alcohol in some countries. It's really hard to say. What I can tell you is that it is not recommended that you drink alcohol during pregnancy. Alcohol, even small amounts, can affect fetal brain development. And if you do choose to drink alcohol during your pregnancy, you're doing so at great risk to yourself and your baby. It's best to wait until after you've given birth. And then you can talk to your healthcare provider. Depending on whether you're breastfeeding or not, you may be able to drink some alcohol at that point. But really, alcohol should be avoided during pregnancy. If you have more questions about drinking alcohol, we do have a video on that, and we can link that in the description, in the chat. Okay. All right. So the next several questions all have to do with antibiotics. So in general, if you are given antibiotics for an infection, you want to make sure that you're taking the entire amount of the antibiotics. If you only take a couple pills, you will start to feel better, but the bacteria isn't actually killed off yet. And therefore, in a couple days, you can actually redevelop the infection, which can be worse for you and for the baby. So the first question is, I'm 9 weeks pregnant and my doctor prescribed nitrofurantoin and phenazopyridine. Are they safe for my pregnancy? So these two medications are actually very commonly used for urinary tract infections, which are one of the most common infections a mother can develop during her pregnancy. They're both very effective in treating this. And the phenazopyridine is actually a medication that's used for the pain associated with that urinary tract infection. And the answer is both of these are safe to use during pregnancy. Again, no matter what you read, you want to complete the full course of medication as prescribed. The other thing I want to let you know is phenazopyridine is also known as AZO, AZO, over the counter. And so this is something that you can also pick up over the counter as long as your healthcare provider has approved it. The next question, my wife was just prescribed cefixime, Cefixime, for those of you, if I'm saying it wrong, 1 per day for 5 days. She is 14 weeks pregnant. Would love to hear your thoughts. So cefixime is safe for use during pregnancy, even at 14 weeks. If she's being prescribed this is most likely because she has some kind of infection. What you should know about infections during pregnancy is that infections that are left untreated can lead to preterm birth, stillborn birth, and possibly even some developmental delays to the baby. So it's very important that you treat your infections properly. The next one, I'm 15 weeks pregnant. Is it safe for my baby to take antibiotics like cephalexin? So, the answer is yes. Cephalexin is safe for use during pregnancy, and is very effective medication. Most antibiotics are actually safe during your pregnancy, and you should go ahead and follow your healthcare provider's advice because they're trying to prevent further complications. What people don't realize is something like urinary tract infection, which is contained within the bladder, can spread to the kidneys, which can then spread to the rest of your system, causing sepsis. So you want to make sure that you are going ahead and following your healthcare provider's advice. Now, our final question came in on an antibiotic video, but the medication is not an antibiotic. So it says, I'm 24 weeks pregnant and I have taken a diclofenac injection. Will it affect my baby? So diclofenac is in a family of medications called NSAIDs. And NSAIDs are actually not safe during pregnancy. In the third trimester, this can actually cause a life-threatening complication with the baby. So for somebody who's taken a diclofenac injection, you actually need to contact your OBGYN, and it is my recommendation you ask to be referred to a maternal fetal medicine specialist for them to go ahead and do a detailed ultrasound of the baby. So what is a PDA? A PDA is a little hole inside your baby's heart that is supposed to be there while they're in your belly. Because while they're in your belly, your baby's heart circulation is different than when they're outside of your belly. And so that hole is actually very, very important to making sure they do well inside. Okay? Once your baby is born, that hole automatically closes. And that's normal and it's healthy and that's what it's supposed to do. If that hole closes early or prematurely, that can cause life-threatening complications to the baby and possibly lead to stillbirth. So diclofenac and other NSAIDs like Motrin, Advil, ibuprofen have all been known to potentially close this hole early. In fact, when a baby is born and that PDA, as we call it, which is patent ductus arteriosus, if that hole stays open and we need it to close, these are the medications we actually give to the baby to close it. So unfortunately, for this mom, you should seek care from your OBGYN and have them perform a detailed ultrasound of the baby's heart to make sure that everything is okay. Now, I think that one of the things I want to mention about the diclofenac in general is if you ever have any questions about a medication, be sure to ask your OBGYN before you take that medication. And also you can ask your local pharmacists. Pharmacists are often your secondary resource for figuring out if a medication is safe for your pregnancy. Don't hesitate to ask questions. That's what these providers are there for. All right. Thank you for those of you who are joining us. Remember, you feel free to put any questions in the chat. So our next several questions are about bleeding. I get a lot of questions about bleeding every week. So the first question is, I am pregnant and still having my period. Is that okay? So the answer is, if your baby is doing well and you are doing well, it is okay to still have a regular menstrual cycle. In fact, a lot of women do have a regular menstrual cycle, sometimes throughout their entire pregnancy. There's no reason to explain why this necessarily happens, but it does happen. And so what I would tell you is you want to be sure you're monitoring your bleeding. If you see any changes at all, you need to contact your healthcare provider immediately, even if that means you're contacting them every single month. Bleeding is not considered normal during pregnancy except during labor. So you always want to let your healthcare provider know what is going on. The next one, I am in my 14th week and noticed sudden bleeding last night, rushed to the emergency room. My doctor investigated and confirmed that my cervix was not open and my baby is fine. Initially, I had conceived twins, DCDA, which is the position of the twins, and the types of placentas they have. And unfortunately, one of the baby's heartbeats stopped in the 10th week. Could this be the cause of the bleeding? So the answer is yes, this could be the cause. So when we have a miscarriage, one of the things that needs to happen is the baby needs to leave the body. And with that, the placenta, which is the organ that feeds the baby, it needs to detach from the uterus and also exit the body. If these are left inside your body, you can develop infection and other complications. Now, it does happen that some women will become pregnant with twins, and unfortunately, they will miscarry one of the two babies. When this happens, there can be a delay in the one baby coming out through the vagina because usually that is accompanied with some contractions. They may not be contractions you feel, but that's usually part of what happens. So when this all of a sudden decides to happen naturally, you might see some bleeding, which could have happened in this case. The other thing is, of course, the question becomes, why was the one baby a miscarriage? If there was any genetic abnormalities, the other baby might share those genetic abnormalities and the body might sense that. Also, there could be placental issues or something else, which is why this mom did the right thing and she went and got checked out. All right, so our next question. I'm 16 weeks pregnant with my second pregnancy. My first pregnancy, I had a placenta abruption in the 8th month. Now at 16 weeks, I had bleeding and brown discharge. Is there any problem? Okay, so let me just see this. So the first pregnancy had a placenta abruption. So I don't think these two things are necessarily related, although I can tell you that if you have a history of placenta abruption, you are at a higher risk. So for those of you who don't know, placenta is the organ that feeds the baby. This is the uterus. The placenta attaches to the uterine wall. A placental abruption is when the placenta pulls away from the uterine wall. It's considered a medical emergency, and both mom and baby can actually become seriously ill or pass away within minutes of that happening. So usually an emergency C-section is performed. Bleeding and brown spotting at this time could be a variety of things. It could be a placental issue like a subchorionic hemorrhage, and we have a video on that which we can link in the chat. Additionally, it could be just caused from sex. So your vagina, due to the hormones that are needed to sustain your pregnancy, it gets very thin and it can tear easily, especially if you wipe too hard or during sex. And that can lead to a little bit of bleeding. And finally, you could have maybe some dilation of your cervix. That is very possible. So you want to make sure that you're contacting your healthcare provider. Brown blood is old, or brown discharge is usually old blood. Pink and red are also signs of bleeding. All three colors should be given to your healthcare provider. All right, I see we have a question in the chat. This is from Mima. Hi, Mima. So you were prescribed promethazine to help you sleep. You're 21 weeks pregnant. So I am actually going to take this opportunity to look at a special guide that I have for medications. So when your healthcare provider is making these decisions about medications, they should be checking the latest research to make sure things are up to date and current. And I have one of these guides. So let me just check. Okay, so promethazine should only be used when the benefits outweigh the risks. In your case, based off of the fact that it's being used for sleep, depending on what else you've tried, I would tell you that the benefits probably do not outweigh the risks. So what are the risks of promethazine? So promethazine can actually decrease platelets in the blood. Platelets are kind of like a sticky substance that helps prevent us from hemorrhaging or bleeding too much when we get cut. So, if promethazine is taken late into pregnancy, it can predispose both mom and baby to a hemorrhage, which is a life-threatening bleed. And we have a video on that. We can link that into the chat for you. So, the one thing that it's saying is that you want to be sure that you're not using this too late in. And of course, once you're past 24 weeks, sometimes women go into preterm labor for a variety of reasons. The next thing it also says is that this medication can cause respiratory depression in your newborn. So, what this means is at the time of delivery, when your baby comes out, your baby has trouble breathing. Okay, now respiratory depression can be very benign. That means very, very mild, and we can treat it very easily. However, it is still scary and oftentimes requires a higher level of care in the hospital. So, really, there's so many other options for sleep that this wouldn't be the first one I'd go to. So, one of the things I would tell you, Nima, is you want to talk to your healthcare provider about Unisom. So, Unisom is an over the counter sleeping pill that we actually recommend to women in the first trimester to help with morning sickness or hyperemesis gravidarum. It's completely safe during your whole pregnancy. The biggest complaint a lot of moms have is that they'll be a little groggy the next day, but if you get a good night's sleep, it tends to be worth it. So it kind of hits you up for a couple different benefits. Another medication that can help you sleep is Benadryl. And you want to ask your healthcare provider if you're eligible. But Benadryl, again, is safe for use during pregnancy. The only thing you want to do is towards the end of your pregnancy, like 38, 39 weeks, you probably do want to stop the Benadryl use because it can interfere with your colostrum production because it's meant to dry stuff out. You can also ask about magnesium or vitamin B6. These are other natural substances. Now, there are some other medications, including some antidepressants and some antipsychotics, which sound scary, but they really aren't, that could help you sleep, that don't have the risks that promethazine has. So I would tell you to ask your doctor about other options. All right. So going back to some of these questions, again, we are talking about bleeding right now. On my 25th day, I got implantation bleeding. I got symptoms again after day 51. Bleeding is not much, but it's my period red color with white clots. Is it a miscarriage or is it my period? Like both bleeding 26 days. So the answer is I'm not sure, but it could be a secondary cycle happening or a miscarriage. The thing is, what I would definitely be telling you to do is contact your healthcare provider. Whenever there's bleeding, they should be assessing you. And the best assessment is to do an ultrasound to check the baby. They can check for a heartbeat. They can check for a sac. They can check to see if they see anything at all. They usually will do an abdominal, which is on top of your belly, as well as a transvaginal. That means they will have a probe that they stick up the vagina because they get better images that way. Now, in addition, if you're not sure if you've had a miscarriage, take a home pregnancy test, okay? Or ask your doctor to do the blood test, but they'll have to do 2 blood tests to confirm what's going on. This is another way for you to figure out what you are actually experiencing in the moment. Yes. So I see your question, Mima. So the names are Unisom, which is let me see if I can type it. Hold on. Unisom. There you go. These are the 2 vitamins and the 2 over-the-counter medications that I would recommend for sleep. Okay. So I'm 14 weeks pregnant and I'm kind of scared because I've been bleeding for 2 weeks. According to my OBGYN, my baby is okay and my cervix is long and closed. So I'm glad to hear that this baby's doing okay. And this question or this comment kind of highlights something that you should be aware of. When you are pregnant, part of what determines whether you're going to have a miscarriage is whether your cervix is dilating. So the cervix is the opening to the vagina. So you've got your uterus, and at the bottom of your uterus, you have a cervix, right? So the cervix is long and thick and closed. Okay. So the cervix is never 100% closed. That's why fingers actually do a very good job of demonstrating it. There's always a little teeny tiny slit. That's how come bleeding comes through. If your water breaks, that's how it comes through. And as you go into labor, that cervix is going to open and dilate to allow the baby to come down. When you're early on in your pregnancy, you want this to be very long because as it opens, it goes from being thick to thinning out and opening up. Okay. So it's very good when you are having some complications. If you do have an ultrasound and they say to you, hey, we see a baby, we see a heartbeat, these are good things, and your cervix is long, thick, and closed, those are very good signs that you're probably not in preterm labor. Okay. All right. So our next question is going to be about blood pressure. So I'm pregnant, 40 weeks and 5 days, and my blood pressure is 154/74. Now, this person I responded to immediately and told them to go to the emergency room. So 154/74 is not normal. That is way too high, and that needs to be investigated because pregnant women can potentially have a life-threatening complication called pre-eclampsia. And pre-eclampsia, if left untreated, can lead to eclampsia, which includes seizures and organ failure and can result in the death of both mom and baby. So you do not want to ignore high blood pressure during your pregnancy. It is very serious and needs to be taken seriously. Some of the signs that you might be experiencing high blood pressure, especially if you aren't expecting it, if you get a headache and it's a headache unlike any other headache you've ever had, and you take something for it and it doesn't work, that's a very, very positive sign that you might have high blood pressure. The other thing is if you have any type of visual disturbance. So we'll tell moms if you see lights flashing, if you see things floating in front of your eyes, if you see spots, if you see tunnel vision, if you see blurry vision, anything that changes your vision is a possible signal that your blood pressure is too high. And finally, if you get pain in the upper part of your belly on the right side, that can also be a sign that you are experiencing high blood pressure. If you have any of these symptoms or anything else, I recommend that you take your blood pressure at home if you have a blood pressure cuff, or you call your healthcare provider immediately and let them decide how they want to assess you, okay? And just remember, for those of you who have joined us, thank you so much. Please feel free to put any questions you have into the chat. All right, so our next couple questions are going to be about C-sections. So after a C-section delivery, when can we start using stairs? This is a great question. So a C-section is major surgery, okay? It's no joke. And I think we take it lightly because we expect women to be up and about and taking care of a newborn almost right away. Now, I'm not telling you to stay in bed after your C-section. It's actually better for you to be moving around, but you need to take it easy while you're doing this. So the question about stairs, it depends on how fit you were ahead of time, how complicated your C-section was, and how often you might need to use the stairs. So what I usually recommend for moms in the first week or two is that you try to minimize the amount of stairs you're using, and you definitely don't want to be carrying heavy loads up and down the stairs. Baby is about as heavy as you want to carry. So, your first week at home, you try to stay upstairs until you absolutely can't anymore, and then come down and stay downstairs for the day. That being said, if you need to use stairs, you need to use stairs. You just take it easy, you go slow, and you ask for help. How many months after C-section can I start a job? This is another great question. And unfortunately, I don't have an answer because it depends on the job. Honestly, there are women who go back to work within a day or two of coming home after their C-section. But most of these women are working at a job, at a desk, at a computer. So they're not really putting any strain on their C-section incision. At the same time, if your job involves, say, jumping in and out of a truck to deliver packages, you're probably not going to be able to do that for about 6 to 8 weeks after your surgery. So deciding when to go back to work is a conversation you have to have with your healthcare provider because they know the complexity of your surgery and they are also monitoring your healing. What I will tell you is it's best to try to take it easy as much as possible. Now, the other thing is in today's, busy world and in today's expensive world, some of you may need to get back to work sooner than later. So if you're one of those people, please don't be afraid to tell your healthcare provider so that they can give you the proper guidance to be able to do that safely. Okay. So if a healthcare provider knows that you have to go back to work after 2 weeks because you don't have maternity leave, and let's say you're going to be standing on your feet for 8 hours a day, they may tell you, I need you to put your feet up for an hour after you get home, or I need you to not be cooking dinner. Somebody else has got to take that over. They can give you guidance. So make sure you're letting them know. All right. Our next question about C-sections. After 7 months, my C-section healed and was red and painful. The next day, a stitch opened and I had a small wound on my right side. The doctor gave me antibiotics and ointment, but it still hasn't cured the small wound. What can I do? I'm scared. So let's talk about how they do a C-section. So when you go into the operating room, they lay you down and they clean your belly. Okay. And then we open you up with usually a type of knife that also kind of burns the tissue to prevent bleeding. Now, there's many different layers that they have to open of skin and muscle before they get to your uterus. And then they do a small incision in the uterus to bring your baby out. After that, they start the process of sewing everything up. So they start with the muscle and they sew that, and then they go to the skin, and then they have the outer layer of skin, which is what you see. Now, the inside, they use dissolvable sutures or stitches. So over time, they just get absorbed by your body and they go away. On the very outside, they will also do that. But some people will have a reaction to those stitches, which can prevent a little bit of healing. And I'm wondering if in this case, that's what happened to you. It sounds like there's possibility that you could have been allergic to the material that they used, which is causing your body to react. Now, the little opening is probably not the end of the world as long as an infection doesn't occur. But at this point in time, being that you're 7 months out from your C-section, you need to ask to be seen by a specialist. You need to ask them to send you to a surgeon to look at the whole thing and see what else that they could do. Because they may actually have to open up the surface of that again to figure out what's going on, which I'm sorry to say that, but it sounds like it hasn't healed properly. Okay. What you want to do in the meantime, and with any C-section, don't put any ointments, creams, powders, don't put anything extra on other than what your doctor has prescribed, because a lot of those ointments and creams can actually cause infection. All right. Just anybody who's joined us, thank you so much. We're here on Monday night for our live Q&A session where we're answering questions from our viewers that have come in on the videos. I'm Dr. Samantha, the maternity mentor. Please feel free to put any questions you have into the chat. All right, our next question is about cholestasis. So in my first pregnancy, I suffered severe cholestasis in my 6th and 7th month of pregnancy. Because of that, I ended up having a premature baby, which survived only 3 days. Now I'm pregnant again, and my 5th month is almost complete. Please provide some guidance to overcome if I have cholestasis again in the late 6th or 7th month. Unfortunately, cholestasis, which is basically a buildup of bile and stuff in the system, there's nothing you can do to prevent it. You are at a predisposition for having it again. So the only thing you can do is try to make the rest of your pregnancy as healthy as possible and as safe as possible so that your baby is doing the best it can in case that premature birth happens. So first, they should have you being seen by a specialist, a maternal fetal medicine doctor. These are the doctors that specialize in treating women who are having complications during pregnancy. Because you had a previous preterm birth and your baby passed away, they should have sent you to this type of doctor for a consult, okay? Because if you were to develop cholestasis again, this is the doctor that should be monitoring you and can give you certain medications at that time that may help mature the baby's lungs. If in order to maintain a healthy pregnancy, make sure you're trying to get some exercise daily. A walk is perfect. Drink plenty of water. Make sure you're resting. Make sure your sleep is well. Try to relax. It's very hard. And I know, especially when you've lost a baby, you can feel very anxious, but that anxiety builds a lot of inflammation in your body, which can be bad for the baby. So try to use yoga and meditation and other tools to help you try to relax, and then just monitor for symptoms. The second you have any symptoms, call your OBGYN, ask them to order blood work, and ask them to start monitoring you for cholestasis. Cholestasis can be life-threatening, and if it gets too far along, we do deliver babies prematurely, and this is probably what happened with this mom. All right, so our next question is about depression during pregnancy. So what about the medications amitriptyline and zopiclone? Can they affect the baby? All right, so let's start with amitriptyline. Amitriptyline is a tricyclic antidepressant. Tricyclics have been around for years and years and years. So you need to know that with any medication, this includes antibiotics, blood pressure medications, diabetes medications, depression and anxiety medications, any medication, they cannot do any studies on a pregnant woman. It's not ethical. So the only way we're able to gather safety data is when doctors submit information about using medications with their patients to clinical trials that look at things from a retrospective. They're just looking at the data. They're not actually performing any kind of tests. And then we look at the pharmacokinetics, which means like the size of the molecule of the medication. Is it fat soluble? Is it, water soluble? These are very complex concepts, but this is how we determine whether a medication is safe. Okay. So with the tricyclic antidepressants, while there have been no studies, they have been used for years and years with pregnant women, and they have been found to be very effective and very safe. I particularly like amitriptyline because amitriptyline doesn't cause a lot of weight gain. It's pretty good for depression and anxiety, and it's indicated for both. And it makes you sleepy. And pregnant women often have trouble sleeping. So for a woman who's experiencing depression and anxiety, amitriptyline can actually be kind of like a one-stop shop for fixing several things. Obviously, you do want to contact your healthcare provider and get their opinion, but this is a pretty safe drug. Now, the other one, zopiclone. Okay. This one is not safe. I do not recommend it. You cannot just go off of it. You're going to need to be tapered off of it, but you need to try to stop using this medication. So this is a benzodiazepine, and benzodiazepines are a class of medications that are used primarily for anxiety. They work fantastic for anxiety, but they are highly addictive. And when you stop these medications, especially if you stop them abruptly, you can have seizures. Now think about a baby. Your baby is receiving tiny doses of this medication across the placenta. When you deliver the baby, that tiny dose of medication stops abruptly, and then the baby could have seizures. So all the benzodiazepines come with that risk, and many babies, they will have to go to a neonatal intensive care unit to receive specialized treatment to help taper them off the medication, because they oftentimes have withdrawal symptoms, and also to monitor them and make sure they don't have any seizures. Okay. Now, if you taper yourself off this medication under your healthcare provider's guidance, while you are pregnant, the baby will get less and less. And then by the time you deliver, the baby will hopefully not have these withdrawal symptoms or be at risk for seizures. But again, you cannot stop this medication on your own. It can cause seizures. If you have a seizure, the blood flow stops to your baby's placenta. So you must contact your healthcare provider and get care under their guidance. All right. Our next question is about diabetes. Any tips for pregnant women who are hypoglycemic? I've been having a lot more low blood sugar episodes. So, this is a great question. And unfortunately, a lot of women who develop diabetes during pregnancy, their sugars just go up and down. It's very, very hard to regulate during pregnancy, which is why we oftentimes go straight to insulin because all of the oral medications like metformin and glucophage, which can be traditionally used for diabetes, they just don't work during pregnancy because too much is changing. Hypoglycemia is low blood sugar. When you have low blood sugar, you can actually become dizzy and pass out. And of course, if you pass out, you can fall to the floor. And a pregnant woman does not want to fall to the floor because she can fall on her baby. So it's very important that we prevent these hypoglycemic episodes from occurring. Now, what's the best way to do it? Well, in the hospital, if we are treating a woman with diabetes and we see low blood sugar, we do two things. We give her juice to get it up, and then we give her protein. Now, juice, because it's fast acting. I know when you have diabetes, you're not supposed to drink juice. Please do not drink juice on a regular basis. But if your sugar is low, if you know it's low, you're having symptoms that it's low, you need to get that sugar up fast or else you can pass out. So juice is one of the fastest ways to do that. But when we eat or drink something that has a high amount of sugar, what our blood sugar does is it spikes and then it drops again. And you're going to be back to where you started in like an hour. So what you need to do is you also need to have protein with that. And in my opinion, one of the best things you can have is cheese. Okay. Cheese is usually very well tolerated. It's very long lasting. And the nice thing about cheese is you can actually keep a cheese stick with you at all times. I know normally we kind of keep cheese in our refrigerators, but really a piece of mozzarella cheese can be in your purse all day long and you can still eat it. Okay. Some other options are nuts or peanut butter. You could even do a little bit of yogurt, but cheese is a really, really high source of protein and it has very little to no carbs. So like, for example, yogurt, which sounds like it would be ideal, actually has a lot of sugar in it. So you're contributing to that potential spike. All right. Another question about diabetes. I had my glucose checked earlier in my pregnancy around 18 weeks, and I did the 1-hour test. I was at 134 milligrams per DOL. I'm 27 weeks and checked my fasting sugar right when I woke up. It was 119. I checked a little less than 1 hour later. I still hadn't eaten anything or done anything, but I brushed my teeth, no water, and it was 87. Is that normal? I know my doctor said I'm borderline and I will be getting tested again next week. What can I do to improve my blood sugar if I have a desk job? I'm obese and I don't even know where to start. Okay, so your blood sugar should be ideally under 110, and some guidelines say under 100 when you test it in the morning before you've eaten anything, which is considered fasting. So the 134 and the 119 are too high. And honestly, the guidelines are changing to the point that now we're basically only doing the 1-hour test. And if the 1-hour test is failed, you are considered diabetic because it's so important to get that treatment going right away. So what can you do? Keto. And I have a video on it, and I'm going to link that into the chat box. The ketogenic diet is really, it's perfect for a pregnant woman to use to help with her diabetes. Okay. And I recommend dirty keto. So the ketogenic diet is low carb, high protein, high healthy fats. That's the key, healthy fats. So stuff like olive oil, avocados, some of your nuts, things that are very good for you. Dirty keto is basically taking the keto food list and eating within reason using just those foods. Okay. So you want to make sure your body needs protein and it needs fat in order to digest that protein, but you don't need as many carbs. Your body will convert that protein and fat to carbs. And the carbs in our diet are usually very processed, and therefore they don't even have a lot of benefit to us nutritionally. But the keto diet isn't no carbs, it's just low carbs. So, for example, one of the things keto will do is it does discourage you eating a lot of fruits. And frankly, if you're diabetic, you shouldn't be eating a lot of fruit. But it does encourage certain fruits, which are higher in fiber and lower in carbs, like berries. Berries are one of the perfect fruits for you to eat if you're diabetic. So what I would tell you is if you are unfortunately at a sedentary job and you're not able to, get out and move around as much, trying to eat lower carb is going to be better for you. One of the things that I would recommend is that you talk to your healthcare provider and ask them for a referral to a nutritionist that specializes in giving counseling for diets to pregnant diabetic women, because it is a very specialized area, and they can hopefully help you develop some meal plans and such that can help you get better guidance. For anybody who's joining us, thank you so much. Feel free to put any questions you have into the chat. All right, next question is about drying up breast milk. I have been exclusively breastfeeding my son since birth. He is 18 months old now, and I'm ready to stop breastfeeding. I don't want to stop cold turkey, and I would like to only feed at night. Can I get some tips on how to avoid engorgement throughout the day? Also, my left breast produces lots of milk while my right breast feels almost empty. What could help with this? So if you're going to stop breastfeeding all but at night, the right breast is probably just not going to be able to produce as much. Unfortunately, it's in order to stimulate that breast to produce more, you'd end up stimulating the other breast, and that's going to inhibit the process of what you're trying to do. So to stop your feeds during the day, you kind of have to start by making them less and less time. And I honestly would recommend that you stop feeding the baby on your breast during the day, but you simply pump. So if a feeding is normally 10 minutes, you pump for 9 minutes for a couple days, then 8 minutes for a couple days, then 7 minutes for a couple days. If you're doing it for 6 times, once you get to like 7 minutes, drop one of those. So you're stretching out the time. I mean, it's basically like a tapered system of slowing down. But the other thing is you need to teach your body that you still want to make milk at night. So you want to make it a priority to be feeding every single night, no matter what. Now, your body can adapt to this. It is possible. However, you need to know that anytime you potentially start to dry up your milk, you have the potential to dry it up for the entire day. There's no way to know for sure how your body will respond. And so you just got to take it day by day. Finally, you cannot use any herbs or any medications to dry up your milk if you still want to breastfeed at night. All of these things are designed to dry up your milk entirely. And so it will not support you breastfeeding at night. You also can't really use cabbage leaves. Cabbage leaves do have some chemicals in them that help to dry out the milk. And so if you were to use those, again, you're going to inhibit your milk supply at night as well. All right. Our next question is about epidurals. And it's kind of more of a comment, but it's a good one. The worst part for me is the spinal right before the C-section. I have a narrowing between my vertebrae, and they put this thin gauge needle to numb you before the spinal. It definitely never does for me. And then they stick me with the actual spinal needle. They dig around because they have trouble getting into the place. It's horrible and barbaric and usually takes 10 to 15 minutes. Then I get migraines for days after because my spinal fluid is leaking. I've requested an ultrasound as they place my spinal, but they always tell me we don't do that. Definitely not having another baby after this one because I suffer from nerve pain and damage. And I'm very sorry to hear that this happened to this mom. And I think this is really important to talk about because this tells us about epidurals in general. So what is an epidural? It's anesthesia that goes into the spinal column to numb you from basically like the belly down so that you can have your baby, whether it's vaginal or C-section, without pain. Now, in order to do that, they have to put a needle into the spinal column. And you have these vertebrae, so little like kind of puzzle pieces that go down the spine. And they have to get in between those. So when you're getting ready to do your epidural, they have you bend down. So we have you take a pillow and kind of lean over. And when you lean over, this opens up those spaces between the puzzle pieces. So the more you round your back out, and it's important you round your back out the more space there will be. Now, sometimes you have had pre-existing accidents or injuries, which can make it harder to get through those spaces. But it is something that the more you're in the right position, the better it is. Now, then they put the numbing. So she described it. It's a little thin needle and they inject you with the numbing solution. And I always talk to my patients, unfortunately, this part hurts. It really does hurt. It's sting and a burn and it's intense and you just breathe through it. But the reason for that is because then they can go ahead and they can use the needle that they need to use to get into the spinal area. Now, I will tell you that I have never seen it done with an ultrasound either. Here's why. The procedure is considered sterile and they want to introduce as little items into the field as possible. So I would tell you that I have never seen it done as well. And it doesn't matter what kind of provider that I've been working with. Now, she mentions that she gets horrible headaches because of spinal leaking. So after you've recovered from your surgery or your vaginal delivery, you go upstairs and the next day you may start to get headaches. If you get a headache, you need to tell your providers. This can happen because the little space where they put the needle, sometimes there will be a little bit of dripping of the spinal fluid that comes out. And this lowers the amount inside the brain. Now, this sounds crazy dangerous. It's not. The brain is surrounded by spinal fluid as like a balloon. So it's kind of floating there. So when the spinal fluid level goes down a little bit, the brain kind of sits against the bones of your skull, which is what causes the headache. So this is actually not a medical emergency, but it is very painful. So what we do is we take you back and we do what's called a blood patch, okay? So a blood patch is where they actually take a little bit of your blood out of your arm and they inject it into that space. Because remember, your blood has platelets that will coagulate and cause a clot to prevent you from bleeding out. So when they put a little bit of your blood there at the hole, it clots and it plugs up the hole. And your body is constantly producing spinal fluid, which means your body's going to replace that fluid very quickly and you start to feel better. Now, the final thing she mentions is that she was uncomfortable after her epidural. So epidurals do have a risk factor of you having some pain in the back and the potential for nerve damage, although both of those are rare. The next question is about formula feeding. And this mom, she watched my video, which was awesome. And she said, is there any research about how formula does not cause gas, fussiness, or colic? And so the answer is yes. She wanted me to reference some guides. And what I will tell you is there's too much for me to reference. And really, when it comes to feeding, a lot of people get confused because they always hear breast is best, breast is best, breast is best. Formula causes colic. I'm going to tell you, I have seen 1 million babies who are breastfed only who have colic. Okay. Colic is not exclusive to formula. Gas is not exclusive to formula. Frankly, one of the major things that causes a baby who's getting formula to feel uncomfortable, gassy, and colicky is cow's milk. Well, the same thing can happen to a breastfed baby. If mom is drinking a whole bunch of cow's milk or eating a whole bunch of dairy, her baby can develop colic as well from the same type of sensitivity. So the bottom line is that there's no way to know for sure how your baby's going to react to what feeding that you choose. If you choose to formula feed, I think that's fantastic. Formula is great. If you choose to breastfeed, I think that's fantastic. Breastfeeding is great. And if you choose to do both, I think that's fantastic. They're both great. If you have a baby that develops gassiness and colic and stuff like that, talk to your healthcare provider, your pediatrician. I usually tell my moms to ask if you can give a probiotic. Probiotics are bacterial strains that are good for your gut, and they help you to digest and to have less gas and less stomach pain. And babies can get probiotics too. So I would tell you, if this is happening, to go ahead and ask your pediatrician about that. Our next couple questions are about labor. I'm 28 weeks and I have a lot of backache on both my sides hurt. I also feel pressure in my tummy close to my vagina. Okay, so backache, pain and pressure in the vagina and the sides of the stomach hurting are all signs of preterm labor. So I actually messaged this mom and said, you need to go to the hospital to get checked out. If you're having any signs of preterm labor, you need to be checked out. And we'll link the link for our video in the chat. But signs of preterm labor can include contractions where you feel like your stomach is hardening and softening, period cramps, backache. You can get some vaginal discharge. These are all warning signs, okay? One of the most common causes of preterm labor at the time that this mom said, which is 28 weeks, is dehydration. So many times women will come into the hospital to get checked out. They will be in true preterm labor. We give them a bag of fluid and it stops. And that's because they were dehydrated. So one of the things you can do to prevent preterm labor in your pregnancy is to make sure you're drinking plenty of fluids. A lot of pregnant women avoid drinking because then that means they have to go to the bathroom more often and they're already going a ton. But really, that's the best thing for you and your baby is to drink plenty of fluids. It prevents preterm labor. It prevents urinary tract infections. It helps keep the placenta flow better. It lowers blood pressure. It's fantastic. Water is great. I'm 38 weeks. This is my second pregnancy. 3 days ago, I became extremely sick with what I thought was a stomach bug. I threw up and haven't been able to eat much since. I threw up again after eating today too. It almost feels like my first trimester again. Is this a sign that labor could begin soon? So it's hard to say with this mom. And what I would say is you need to call your healthcare provider. You might have a stomach flu. You might have food poisoning. But throwing up and nausea is a sign of labor. So a lot of women will have nausea, vomiting, and diarrhea when they're going into labor. So why is this? So when you're getting ready to have a baby, you've got this big giant belly that's full of baby. This is baby. Your belly's completely full, right? And the baby needs to now move down through the pelvis and come out. And so your body wants you to be able to concentrate on that. And if your stomach is full of food at the time you go into labor, that's interfering with its ability to contract. It's interfering with its ability to do your job. So oftentimes women will start vomiting to clear out the stomach. And actually, once the stomach is empty, they usually stop. Now, as far as diarrhea, now your baby is passing through the pelvis, right? Through the vagina. Well, right next, if this is your vagina, right next to that is your rectum. And it goes up into the intestine. And this is where all your poop is. And the poop comes out through the anus. If you are full of stool or poop at the time you go into labor, that could actually prevent your baby from descending. Okay. It might not let the baby go through the vagina. So a lot of times the body will automatically start to have diarrhea and stimulate you to poop to get your intestines clear so that the baby can pass through easier. So that's why both of those could be a sign of early labor. But irregardless, if you're having these symptoms, especially late during pregnancy, you want to let your healthcare provider know so that they can assess you. Thank you so much for joining us, guys. We're almost done. But if you have any questions, please feel free to put them into the chat. So how regularly should I change to a new pacifier? So I'm not really sure what this question is asking. I think she's asking how often does she need to change the pacifier? And the answer is the pacifier doesn't need to be changed unless it gets torn or it gets discolored. So a lot of pacifiers, they might be a colored plastic, but they're like a clearish color. So if it was to get cloudy or change color, you would want to get rid of it and replace it, or any tears at all. Our next question is about placenta previa. I still have a placenta previa at 32 weeks. Will it still move, or am I going to have a C-section? So uterus, cervix. Cervix is going at the bottom. This is the opening to your vagina. Placenta is the organ that feeds the baby, and it should attach on the side of the uterus, like up here, okay? But in some cases, the placenta is low-lying or on top of the cervix. This is a placenta previa, okay? Placenta previas are a very big deal if they're covering the cervix entirely, and this does result in an automatic C-section. Now, With a placenta previa at 32 weeks, most likely this mom is going to have a C-section. At 32 weeks, in theory, it still could move. The placenta can migrate up as the uterus gets bigger. So as the uterus expands, it expands like a balloon. That placenta can move with the uterine wall and move away from the cervix. However, if we have a complete placenta previa, which is covering, we usually bring the moms into the hospital for a round-the-clock monitoring starting at about 32 to 33 weeks of pregnancy. And moms are usually delivered between 34 and 36 weeks. The reason for that is if the cervix starts to open like this, well, the placenta is sitting on top. And remember, the placenta has blood going through it. So as that opens, that causes the baby to start to bleed out. Okay. And this can be life-threatening for baby. And it can also be life-threatening for mom. So we want to make sure that we get that monitored. All right. I see that I have a question in the chat. I've been checking my glucose in the morning because of being obese and a family history of type 2 diabetes. It's been in the hundreds. 108 today, 104 yesterday. Does this mean I can potentially have gestational diabetes? And does this mean I would most likely have to have a C-section? So usually we want our sugars to be 110 or below. Some providers will tell you 100 or below. So this is probably a borderline situation. Now, does this mean you have diabetes for sure? No. Is there something you can do to prevent it? Absolutely. I linked our keto video in the description, and I would totally tell you to take a look at that. Keto is a low-carb diet that promotes high protein and high healthy fats, and that can help reduce your blood sugars. Now, ultimately, you need to keep checking and you need to keep monitoring to determine if you do convert to full-blown gestational diabetes. I would tell you to ask your healthcare provider for a referral to a nutritionist that specializes in gestational diabetes during pregnancy. But the second part of your question is fantastic. Does this mean I would have to have a C-section? No. Okay. Gestational diabetes is not an automatic C-section. Gestational diabetes puts you at higher risk of having a large baby. Large babies are what potentially increase your risk of having a C-section if you have diabetes. Now, the reason why the baby is large is because your blood sugar is sitting in your bloodstream because your insulin is not working well. And therefore, your baby's getting tons and tons of sugar, which means the baby grows very big. This sounds in theory like it would be healthy, but it's actually not very healthy. And most of these babies, after they're born, require intensive care because they also have blood sugar problems as a result. So the best thing you can do is monitor your carbohydrate intake, and hopefully you'll be able to prevent yourself from having a C-section. If you want more information, definitely check out the keto video, and we'll also put in a link for our gestational diabetes video in the chat box. I'm going to try to get to a couple more questions before we end because we're almost out of time, but I only have a few left. I'm in my second trimester, but I'm still scared of having sex, especially when I feel pain in the bottom of my belly. So sex during pregnancy is generally speaking safe. Okay. Unless your healthcare provider has told you not to have sex, you can have sex. It does not hurt your baby. Hopefully, if you are having sex, you are having good sex and you're having an orgasm. So an orgasm does cause the uterus to contract, which is kind of like to squeeze like this. And just so you know, for the baby, those contractions feel fine. It's almost like having a massage. They don't notice. It doesn't bother them. Now, if those contractions cause you pain, or if sex is painful to begin with, you need to contact your healthcare provider and get that investigated. That would be a reason to potentially tell you to not have sex. So I think that you being concerned is very valid. I'm not telling you that you can't have sex, but I think you should ask your healthcare provider to check things out and make sure everything's okay. You might also have a fibroid in your uterus, which is like a little growth, which is not cancer or anything. But maybe when you're having an orgasm, when you contract, that's causing a little bit of pain. So whatever it is, you want to figure out what the cause is. Urinary tract infections. Is it safe to take monorail during pregnancy? My wife has a UTI. Monorail is an antibiotic. It is extremely safe to take during pregnancy. Please take it. UTIs are one of the number one reasons why a woman will have preterm labor or preterm birth. So, and urinary tract infections can lead to sepsis, which is a systemic infection that can be life-threatening for mom. So yes, if you are prescribed an antibiotic for your urinary tract infection, you want to make sure that you take all of that medication as prescribed. All right. Our last question that we're going to answer is about pre-eclampsia. I had pre-eclampsia and I was induced. And I ended up bleeding all over the floor and I had to be taken to the labor room. And this was because she was breech. So this mom, she's had a postpartum hemorrhage and preeclampsia, and she now has PTSD and has not been able to have her blood pressure taken because she has severe panic attacks. So childbirth can be very scary. Preeclampsia, we just put out a video on that this past week. Preeclampsia can be a life-threatening condition for both mom and baby where you have organ failure and high blood pressure, which can lead to seizures. Then if you're having complications during that delivery, which does sometimes happen, that can lead to postpartum hemorrhage, which I think we have a link in the chat for. Postpartum hemorrhage can also be very traumatic and it can put your life in danger. So when something traumatic happens to us, we oftentimes have a physiological anxiety response that will manifest long after the traumatic event has stopped. So what I would tell this mom and any of you who have any type of traumatic experience related to your birth is to seek out help. There are online support groups that are free. You can access some of them through Postpartum Support International. And their groups are free and they have trauma-based groups where you can talk about your trauma and speak with people who are extremely knowledgeable in these areas. The most evidence-based treatment for PTSD is therapy and counseling. So you probably also want to engage in some trauma therapy on a one-on-one basis. And finally, if this trauma is affecting your life and your ability to get healthcare, you should consider possibly starting a medication for anxiety. There's a lot of medications that can be used safely. They're safe for breastfeeding. They're safe for you for a short term. They're safe for you to get pregnant on again. There are also some homeopathic vitamins and supplements that can be used to help with your anxiety and depression. So PTSD should not be taken lightly. If you leave it untreated, it can lead to insomnia. It can lead to panic attacks. It can lead to cardiac complications. And so it's very important that you address this. And I'm going to put the name of that organization into the chat. Let me see. This organization is very well known and very well respected across the world. And they have a lot of great resources in multiple languages. So we didn't get to everybody's question, but we got to most of them. I am going to save the next couple, hopefully for next week. I want to thank you all for coming. My name is Dr. Samantha, and I am the maternity mentor. Remember, we're putting out videos every week. We have a new video coming out tomorrow. You can also find us on Facebook, Instagram, and Twitter. So please like and subscribe to the channel. Please tell your friends and family. And remember, we are going to be doing our live Q&A sessions every Monday at 9 p.m. Eastern Standard Time. And this is our opportunity to hopefully engage with you and answer any questions that you might have. The way my questions come to me, because I see I have, is there going to be another one? And yes, next week. If you are watching one of my videos and something pops into your head, even if it's not necessarily related to that video, feel free to make a comment. That's where we grab these questions for these sessions. All right. Thank you again so much. And I hope to see you again soon. My name is Dr. Samantha. I'm the maternity mentor. Bye for now.